Hello, it's almost 11 a.m. here in Seoul. I'm Oh Soo-young at the Arirang News Center. We're breaking into our regular programming to bring you a live briefing from the South Korean health authorities on the coronavirus outbreak here in the nation. In just a few moments, we'll cut into the briefing at the Sejong Government Complex with simultaneous interpretation available for you in English. Director of Public Health Policy Yoon Tae-oh will be briefing us on the coronavirus situation here in South Korea, filling us in on the number of new infection cases seen as of midnight Monday, and what kind of efforts the government is making to contain the virus, especially with the extended Chuseok holiday period ahead and all these cluster infection cases we have recently seen in the capital area, although the numbers have fallen below 100 as of Sunday. So we are going into the scene right now, into the briefing room, and it looks like the Director General is just about to begin the briefing.
First of all, we have Mr. Yoon Tae-ho with the explanation on the COVID-19 response here in South Korea. Let us now begin our regular briefing for September 21st, Monday. As of today midnight, we have 70 new cases today, and of them, 55 are local infections, and among them, 40 are concentrated in the metropolitan area, and we also have 15 new imported cases. And we had 2 additional fatalities, and so far the accumulated death toll stands at 385. I extend my deepest condolences to the deceased and the members of the bereaved families. We are exerting our full efforts to contain the virus through nationwide social distancing measures, and our confirmed cases is on a steady decline. And especially in the metropolitan area, we have seen a drop in the number of cases below 50 in about 40 days since August 13th. Of course, we need to factor in the reduced number of testings during the weekend. However, we have seen a steady and slow decline in the number of confirmed cases here in the metropolitan city. And starting from the weeks when we had the peak of the confirmed cases, we had about 240 cases on average on a daily basis, while this has dropped to about 80 during the past week. And also the same goes for non-metropolitan areas as well. And during the past 3 weeks, we also have seen about one value of the reproduction rate of the virus, and we believe that these are all thanks to all of the measures put forth by the members of the public to refrain from having social contact and refraining from going outside, as well as practicing social distancing measures. Nonetheless, we are not at a stage to let our guards down as of yet. As of last week, we have seen a 20% range of our untraceable patients, and also we also have a very low rate of manageable and controllable patients under the management of the quarantine officials. And we also have a possible surge in the possible outbreak during the Chuseok holidays, during which we will have a great increase in the mobile traffic. And also we believe that easing social distancing measures could also lead to a major outbreak going forward. And this is why the government has extended the measure of social distancing to non-metropolitan area until the 27th of September, just like the metropolitan area. However, these measures and the deadlines are subject to change depending on the conditions of each local authorities. And when we ease the social distancing measures until the 27th, when this comes to an end, we have 2 weeks of a special antivirus period during Chuseok. We believe that these 2 weeks will be crucial in determining the fate of our outbreak during fall, and whether we can also transition into our life
이에
quarantine
정부는 이동
measures.
자제를
And to this
공고하고
end, the
지난
government
9월
has
1일
recommended
발표한
the
수석
members of the
방역관리
public to refrain
종합계획을
from
차질 없이
traveling
시행하며
outdoors and going
범정부적으로
to their
대응하고
hometowns and
있습니다.
travels as well. And we are
먼저
exerting
이번
our
명절은
pan-government
집에서
efforts.
쉬시면서
First of all,
보낼
we
수
are
있도록
advising all
생활
of the
방역 분위기를
public to
조성,
stay home
확산하는
safe and
노력을
sound
하고
and
있습니다.
to get a good rest.
KBS를 통한
And through
국민 행동 요령
KBS, we
방송
also
영상과
will be
쉼을
broadcasting
주제로
our campaign
디지털 홍보
videos
콘텐츠를 제작
to stay
배포하여
home and
이번
guidelines
명절은
and safe
집에서
guidelines to stay
쉬기라는
home.
대국민
And also we
메시지를
will have
지속
many cultural
홍보할
contents
것입니다.
which will be broadcast on
아울러
in the TV
연휴 기간
channels.
집에서
And during
문화와
the
여가를
Chuseok holidays,
즐기실
we will
수
also
있도록
have many
과학문화 포털
cultural
사이언스 올과 문화
cultural
포털의
contents,
집콕
and
문화생활
also
홈페이지
we
등을
have
통해
the dedicated
온라인 문화
homepages
콘텐츠의
which
무료
will
개방을
be
확대
disclosed to the
제공합니다.
public free of charge, and they will include
또한
a various
비대면으로
amount of
가족들에게 안부를 전할 수 있도록
cultural
영상
contents
프로그램의
online.
기능과
And we will
사용법과
also
통신사들이
enable
제공하는
the
다수 동시 접속
free
영상
charge
서비스에
of
대한
free of charge
정보를
video
문자 등을
calls
통해
so that
안내드릴
people
것입니다.
can engage in video calls
교통시설에
with
대한
their loved
집중적인
ones.
방역
And
관리도
we will
강화하고
also carry
있습니다.
out intensified
먼저 개인
crackdown and
교통의
quarantine
이동량 증가가
for
예상됨에
the
따라
transportation as well.
휴게소의
We
실내
will
테이블
also
운영 중단,
suspend
야외
all of
테이블의
the
통영
indoor
가림막
operations
설치 등을
at the rest
통해
centers
방역을
at
강화하는
expressways,
한편
and we will
명절
also
고속도로
put in
통행료를
place
유료로
the
전환하여
dividers
이동량
in
감소를
the
유도하고
outdoor
있습니다.
tables at the rest areas as well.
대중교통의
And we will
경우에는
also
철도는
intensify
상가
our
좌석만
quarantine
판매하여
measures for
판매
public
비율을
transportation as well.
50%로 제한하고
And the sales of
버스는
trains
상가
have
좌석
been
우선
limited to
예매를
about
권고하는 등
50% of its
밀집도를
capacity,
낮추는 노력을
and
함께 기울이고
the same
있습니다.
goes for the buses as well.
성묘
And as
봉안시설
for
방문,
the
불초 등에
visiting
따른
of the
밀집을
ancestral
완화하고
graves, we will
방역을
be
강화하는
also
노력도 함께
taking
기울이고
quarantine
있습니다.
measures for these
이
aspects as
하늘
well.
청사 정보 시스템을
And we will
통해
also
온라인
have an
설명 서비스를
online
제공하고
visit
있으며
of
실내
the ancestral
봉안시설은
graves
명절 전후
and as
2주간
well. And they
시간대별
will be
방문객
open
사전
to the
예약제를
public,
운영하고 있습니다.
and these will be
또한
also
벌초는
carried out by
산림조합과
online
농협 등을
reservations
통한
as well.
벌초 대행
And we
서비스를
will also
제공하고
have a
있습니다.
proxy service
감염이 취약한 시설에
to
대한
take
관리도
care of
강화하고
the
있습니다.
grass
음식점과
in
카페뿐
the
아니라
nearby
콜센터,
graves of their
식품
ancestors.
제조업 등
As
밀폐
we will
밀접한
also intensify our quarantine
감염
measures
취약
for
사업장,
the
물동량
business
증가로
operations
위험 요인이
which
있는
have a higher risk
다양한
of
시설에
infections,
대해 각
including
소관
retail
부처에서
services and food
집중적인
processing
점검과
factories,
관리를
as well
실시하고
as call
있습니다.
centers. And these
명절 제수용품과
intensified
선물
inspections are
마련으로
also carried
국민들의
out
방문이
under
증가할 것으로
these
예상되는
facilities.
전통시장에
And
대해서는
as for the
방역
traditional
점검반의
markets,
활동을
we also
강화하고
have intensified
백화점
quarantine
등
measures
유통
as well.
매장에
And the same
대해서도
goes
소독
for
등
the
방역
department
관리와
stores
함께
as well as
행사와
main
시식
retail
자제를
stores.
권고하고
And we
있습니다.
are advising all of the
요양시설과
users to
의료기관에
refrain from
대해서도
consuming
면회
food
금지를
at
원칙으로
these
하되
facilities.
부득이한
And as for the
경우
nursing
투명
homes and
차단막이
nursing
설치된
hospitals, we
별도
are
공간에서
advising all of the
사전
public to
예약제를
refrain
통해
from visiting these
제한적인
facilities.
비접촉
However,
면회를
we are
실시하도록 하고
also
있습니다.
carrying out
연휴 기간에도 방역 대응과 환자
non-face-to-face
치료에 차질이
contacts
없도록
with
비상
visiting
대응 체계를
with
유지할
the
것입니다.
setting up
방역은
with the
3교대로
dividers as
상시
well.
대응하는 한편
And we will also
질병관리청
intensify
1339
our
콜센터는
quarantine measures for the
24시간
screening
대국민
centers,
상담을
and our
이어가며
1339 call
방역
center will
당국의
be
필수
available
인력도
24/7,
유지하겠습니다.
and we will also have a rotational
연휴
service
기간에도
duty
이용
for our
가능하도록
quarantine
선별
officials.
진료소와
And as
병원
for the
약국,
screening clinics,
응급의료기관 등의
hospitals,
정보를
as well
제공하여
as ER
검사와
rooms,
치료가
and
필요한
also
국민들에게
pharmacies,
불편이
these
없도록
will
하겠습니다.
be information about these
해외
that open
입국자와
during the Chuseok
자가
holidays
격리자에
will
대한
also
관리
be
역시
put
24시간
on disclosure. And we will also intensify our quarantine measures
추석
for the
특별
quarantine
방역 기간
measures in
중
the points of
사회적
entry,
거리두기
including
조치를
the
보다
airports,
강화할
to take a
예정입니다.
crackdown on imported
구체적인
cases.
조치의
And
범위와
detailed
내용은
guidelines
관계
for
부처와
social
지자체
distancing measures
그리고
during the
생활방역위원회
Chuseok
등
holidays
전문가들의
will be
의견을
disclosed
수렴하여
going
이번
further,
주 중
and
세부
they will
내용을
be
발표하도록
disclosed
하겠습니다.
during this week.
코로나19의 위기 속에서
And
우리는
amidst the COVID-19 challenges and the crisis, we have been able to maintain a certain amount of routine daily lives, and we are also seeing a desired need for public solidarity and public unity. And we believe that these are very essential, especially for the understanding and consideration for the families and the families of the confirmed cases, as well as the confirmed patients as well. And please note that COVID-19 is also does not target anyone under certain ages and certain genders and nationalities and ethnicities or religion. And please note that social distancing measures need to also be kept when we also continue to embrace
네,
others
지금부터
as
질의응답
well. Thank
시간을
you very much.
가지겠습니다. 브리핑은 배석자분들은 단상 위로 올라와 주시기 바랍니다.
That was a live briefing from the South Korean health authorities updating us on the coronavirus situation here in South Korea. Director General of Health Policy Yoon Tae-ho just told us that there were 70 additional cases of COVID-19 in South Korea as of Monday midnight, bringing the accumulated cases to 23,045. There were unfortunately 2 additional deaths, bringing the total to 385. Well, that does it for our coverage of this morning's briefing from the South Korean health authorities, but we will be back at midday Korea time with our regular newscast with Mark Broom. Bye for now.